Having a serious health condition is terrifying, and have someone you love with a serious health condition can be just as daunting. When her husband Derek was diagnosed with COVID-19, it turned her lives upside down. The fear was made even harder to bear because she didn't understand what was going on inside his body. They are bringing patients and their doctors together in unique imaging centers where they'll have a mind-blowing consultation that helps them get to grip with their condition from inside out. Dr. Guddi saying they'll get the ultimate insight into what's really going on inside their body. The first patient to one of our imaging centers is 40 years old fashion influencer Hilda from London, who comes along with her best friend. They share a love of fashion since being teenagers. Hilda has been hiding, under her clothes, a growing problem in her abdomen, which has dramatically worsened in the last few months. She's been referred to a consultant gynecologist at St Mary's Hospital in London. The frightening escalation in Hilda's symptoms mean action is now required. Hilda was diagnosed with fibroids, which is the most common gynecological condition in the UK, affecting up to 40% of women of reproductive age. Fibroids are non-cancerous growths that form in and around the womb or uterus. For most women, symptoms will be mild or even non-existent, but in extreme cases they can cause severe pain, bleeding, even infertility, a bulging tummy, all of which are affecting Hilda. She has an emotional moment, because she knows that she will be seeing inside the bump that she constantly trying to hide. Mr. Quinter not only explained to exactly what is going on in her abdomen but also outline a potential treatment that could help her. The key organs in Hilda's MRI scan have been transformed into incredible 3D augmented reality, so what she sees is actually her own insides. For Hilda to find out exactly what's causing her swollen abdomen, she needs to take a closer look at her uterus, as this is the organ where fibroids develop. First, Mr. Quinn wants to show Hilda what healthy uterus looks like. A side-by-side is a healthy uterus and her uterus. When compared to a healthy example, Hilda's uterus is 40 times the size, taking up most of her lower abdomen, similar to carrying a full-term pregnancy. Lua, who's seen Hilda struggle every month with bleeding. While the monthly pain and bleeding were manageable for a while, along with a dramatic change in the size of her belly. Unlike most women, who only experience mild symptoms, Hilda's fibroids are causing significant distress and pushing her belly outwards. At the imaging center, the doctors want to help her understand exactly why. Taking away Hilda's healthy uterus tissue reveals just what's causing it to be so enlarged and misshapen. Bowl-shaped being tumors, or fibroids, are growing throughout, on Hilda's uterus, on the surface and inside, stretching and deforming it to a huge size. There are a lot of big ones. As well as a hereditary link, fibroids appear to be more common in women early to start puberty or who, during menopause, the drop in hormones levels may cause existing fibroid to shrink. Hilda's case is extremely rare. Of women who do have fibroid, just 1/3 will suffer from any symptoms, but if you are worried, always consult your GP. This is one of the most challenging examples of fibroid Mr. Quinn has ever dealt with. When you're living with pain like Hilda, it's all-consuming. We've all experienced at some point in our lives, and Brit's £660 million on over-the-counter pain relief in 2020 alone. Dr. Karen Rajan has the lowdown. A technology to help 50 years old Trudi, who'd been suffering from nerve pain in her shoulder. She meets with Kate at one of our imaging centers where we use our kit to dive deeper into the cause of her painful symptoms. Kate found out her left arm out a bit. She a mother 3 boys with a long-term partner and 12-year-old granddaughter. Trudi currently works as a receptionist, but the recent lack of movement and pain in her arm has forced her to take time off. Frozen shoulder scan has revealed Trudi has a frozen shoulder, a common joint complaint that 1 in 20 of us will suffer from in our lifetime. It occurs when tissue that holds the shoulder joint in place becomes inflamed. It can develop quickly and cause increasing pain and stiffness and sometimes complete immobility. Dr. Dimitri Amiras is a musculoskeletal consultant radiologist at Imperial College Healthcare NHS Trust. Kate hopes that he can give Trudi the answers she desperately needs and offer a treatment that will get her back to her old self. Trudi's own scans have been combined so she can see her shoulder in 3D and get up close to the source of all the pain. Trudi seeing a skeleton. This is the long bit of the arm down here. These images are the key bits of the jigsaw that make up Trudi's shoulder. Kate says the end of it is a ball moving in a sort of cup. The shoulder joint is where the end of the upper arm bone fits into a pocket, creating a ball and socket joint. This incredibly flexible joint allows us to move our shoulder in a full circle. Most of us take our shoulder's flexibility for granted, and Trudi's desperate to. The body's cure is actually ending up causing the problem. It's trying to help, but, actually, it's gone too far. With Trudi's capsule packed full of extra blood vessels to heal the area, there's little to no flexibility or room for the shoulder to move. Dimitri wants to discuss her treatment. A steroid injection will send messages to Trudi's capsule to tell it stop making new blood vessels, creating scar tissue, or sending pain signals, therefore, breaking the unnecessary healing cycle the body's stuck in. Basically, you're going to have to stab through her skin and muscle to get in there. The downside of this technique is that it comes with even more pain. Trudi has a difficult decision to make: live with it or face the procedure head on. One of the best ways for the body to heal itself is by getting a lot of quality sleep. The evidence shows we're a nation of terrible sleepers. Rajan advice: avoid TV in your rooms like zombies movies.
Will raise your blood pressure and your stress hormones. Therefore your body needs relaxation. Winding you down. While Hilda's pressure symptoms are uncomfortable and frustrating, it's the monthly pain and bleeding are the most debilitating.
Are the most debilitating of all. Hilda's heavy bleeding is not only hard to manage, it's also leaving her with very low iron levels, making feel exhausted. This time it's the smaller growth inside Hilda's womb that are causing the problem. Hilda, Stephen will carry out a procedure called a myomectomy, where the outer and inner layers of fibroids are surgically removed one by one and then womb repaired. If Mr. Quinn is unable to control the bleeding, he'll have no choice to remove Hilda's womb. This is called hysterectomy and would prevent her from ever getting in the future. So far Hilda has no children of her own. While surgery does come with the risk of losing her womb, it's still Hilda's best chance if she wants to have children in the future. 50-year-old grandmother Trudi is hoping for a life-changing solution to her frozen shoulder by going down the injection route. In the hope of giving Trudi back mobility in her shoulder that's been stuck in place, causing terrible pain, she'll undergo a series of steroid injections at hospital. That should reduce the inflammation and loosen the joint. Using an ultrasound to guide the needle, radiologist Dimitri starts by administering an anesthetic to help numb the area. A second syringe is needed to inject the steroid and some saline to stretch the joint capsule. Despite the anesthetic, with so much pressure in her shoulder, the procedure is extremely painful. Once administered, the saline will expand the capsule of Trudi's shoulder, stretching out the tissue and loosening the joint. Over the coming weeks, Trudi's will have further injections and a course of physio to stretch the joint more. Over time, return it to its normal. More than 90 fibroids spread throughout Hilda's uterus. Before Mr. Quinn can remove the fibroids, he needs to lift Hilda's uterus out of her abdomen so can see what he's doing. It has to be taken out extremely carefully to avoid damaging any of the surrounding organs. The sheer number of fibroids means hemorrhaging is still a real danger. If that happens, a full hysterectomy may be the only option. After 3.5 hours Hilda's surgery is over and Quinn found some additional fibroids that didn't show up before. The 100 fibroids Mr. Quinn has taken out weigh more than 2 kilograms, ranging in size from 12 centimeters across to just a few millimeters. Also he was able to save the uterus. 4 months since Trudi was treated for her debilitating frozen shoulder. The increased mobility in Trudi's arms means she can lift and hold objects again. She's back at work, with daily physio. Things should keep on improving, so she gets to hug her grandkids again. Hilda came face to face with more than 90 fibroids in her womb that were pushing out her tummy, leaving her exhausted and in crippling pain. It's now been 6 weeks since her operation. Stephen said told to her it was a successful operation.